Doctors are calling it a crisis. Over the next 8 weeks, hospitals across the Kansas City metro expect to see an 80% reduction in that contrast dye.
Came on very abruptly and unexpectedly.
We're not talking about the dye that colors hair. This is medical dye used for x-ray exams, CT scans, and stroke intervention.
It'll guide the surgery that we have to do.
This is video from the University of Kansas Health System. Dr. Philip Johnson says for a stroke patient with a blood clot in the brain, the dye is essential in saving a life.
Anybody that needs a procedure, that needs contrast dye, we're going to have contrast dye.
Johnson is the chief of radiology. He says they do about 1,300 CT scans a week using that contrast dye every day.
Our approach is going to be to reschedule CT scans in patients who have elective exams scheduled that can afford to wait.
I talked with one woman whose procedure has been pushed back 4 weeks here at the University of Kansas Health System. She says it's scary.
You know, it's hard for everybody when they're anxious about their health and they're worried about getting diagnoses made and the process has to slow down.
Dr. Peter Holt says St. Luke's has a similar approach, prioritize patients with the greatest need and offer alternative imaging studies. This shortage does not impact contrast dye for MRIs.
What we provide to them may be different than what they're used to. They may come in and say, hey, last time I did this, I got a CT scan. Why aren't you doing a CT scan?
Holt says metro hospitals are working together to conserve contrast material without compromising patient care.
It's a pretty significant challenge for us to navigate. Now, the fortunate thing is it's temporary, and hopefully after 8 weeks, if we're able to conserve the contrast dye, we'll get back to our normal levels of contrast that are available.
Doctors say this will probably take more conversations with your insurance companies. For example, explaining why a more expensive MRI was done instead of a CT scan. Reagan Porter, Fox 4, working for you.